All right, so this is for chapter 28 for anatomy 2, and this is the male reproductive system. So we're going to talk about the gross anatomy and then the microscopic anatomy of the testes, compare and contrast spermatogenesis and oogenesis, trace the pathway of sperm as it travels through the duct system in the male reproductive system, and then locate and describe the function of all the other parts of the male reproductive system. Compare and contrast sperm, seminal fluid, and semen. You'll be able to name which part of the male reproductive system produces what component of the semen, and name the accessory gland. And then we're going to compare erection and ejaculation, what they mean, what they do, and explain how the male sexual response, how it's started, and how it's elicited. So, just like the female, the male has primary reproductive organs. So here's the mid-sagittal view. The testes, and you can see in the lower left here what goes in the blank. The testes are the primary reproductive organs. Everything else related to the reproductive system anatomy is considered accessory to the testes. So the scrotum is the skin that surrounds the testes that provides a cooler environment that the testes need to have. The testes need to be cooler than the core body temperature for maturation and development. The wall itself has skin, little fascia, and then inside to that, there's a layer of smooth muscle. The dartos, there's the word there, dartos muscle, is one of the main muscles in that area. So let's orientate yourself here. Here is what's called the spermatic cord. This is the oblique muscles on the side of the body. And here's your rectus abdominis. So this is the side. And this is down here would be the male genitalia. So what this is showing is here's some blood vessels coming in here. This is the actual vas deferens that carries the sperm. And then this cord is what I want you to call your attention to, the spermatic cord. So the scrotum has a branch off of it, or a connecting piece off, called the spermatic cord that travels from your abdomen to your testes. Within it, there's blood vessels and nerves that supply the testes within that spermatic cord. There's also a muscle called the cremaster muscle that's formed from extensions of what's called the aponeurosis, and internal oblique muscles that are going to be surrounding that spermatic cord. So the reason why I mentioned the dartos muscle and the cremaster muscle is they're involved with the scrotum's response to different temperatures. And like I said, it's very important for the testes, for the sperm maturation, to not get too hot or get too cold. So with elevated temperature, what will happen is the dartos and the cremaster muscles will relax, and this will allow the testes to move inferiorly or away from, that's what fills in the blank, the body. So they drop lower if it's warmer. The opposite of that, if it's cooler, the body with decreased temperature, they will need to warm up. The testes will need to warm up. So that's when the dartos muscle and the cremaster muscles contract to move the testes closer to the body to conserve heat. This is the testes. This is the penis, and then this is what I mentioned, that other video in the spermatic cord. This is the vas deferens that carries the sperm. So that's the pelvic region of the male. That was a mid-sagittal view. This is a frontal view. This is actual cadaver. And this is a picture of what's going on in the different layers. Make sure you take some time to look at those outside of this video. So the testes are actually quite small. They're housed in the scrotum. Their purpose are to produce the sperm and different androgens, different hormones. There are different layers around the testes. A thick fibrous capsule is called the tunica albunea. And then you have a different layer that contains blood vessels, ducts, lymph vessels, nerves that enter the area. And then the septa divide the internal space of the testes into 250 what are called lobules, L-O-B-U-L-S. Within the lobules, you have these tubules called seminiferous tubules, and these are very important. There's up to 4 per lobule, and these contain the germ cells, so sex cells essentially, that are continually producing the sperm. So the seminiferous tubules are producing the sperm. That's important to remember. Around the seminiferous tubules, you have these interstitial cells, and they are stimulated to produce androgens by a hormone called luteinizing hormone. So yes, men, the luteinizing hormone affects them as well. And the most common androgen that they secrete, the interstitial cells secrete testosterone. So here's what I talked about. So here is the tunica albuinea, that's that fibrous capsule. If you open that up, you see the different lobules, and within them, you see the seminiferous tubules, these coiled areas. These are what produce the sperm. And then around those areas is the testosterone that is produced. This is the spermatic cord up there with nerves and blood vessels and a muscle, that the cremaster muscle that goes down to the testes. This is a histology of the testes of a seminiferous tubule. So one of these coiled areas that has been cut, we're looking in on it. This is the outside of the tubule right here, this line. And then this is the inside of the tubule, or the lumen. So I'll talk about this, but the immature sperm are in the outside of the tubule, and through development, through what's called spermatogenesis, they become fully mature. And the sperm, as you can see here, the mature sperm, or almost mature sperm, hang out in the lumens of the seminiferous tubules. So the production of sperm is a specialized form of meiosis called spermatogenesis. And it occurs, like we said, in the tubule, seminiferous tubule, and it begins at puberty. When a male reaches puberty, they'll have significant increases of the follicle-stimulating hormone and the luteinizing hormone. So we're going to have production of the cells and then production of the testosterone. Okay, so to produce a sperm, there's a pathway of cells, and we'll talk about the names of those. The most undeveloped sperm cell is called a spermatogonia. These are primordial germ cells from which all sperm cells develop from. They're on the outside of that tubule. They are diploid, write down diploid. So these are 46 chromosomes, and they're at the base, or the outside, like I showed you. They divide by mitosis, first of all, to produce the first pre-sperm cell. That first pre-sperm cell is called a primary spermatocyte, and it starts the actual meiosis. So here we go. We're on the outside, and now we're making the step further. Then they develop into secondary spermatocytes through the first round of meiosis. They are now haploid, or 23 chromosomes, and they get closer. As they move closer to full sperm, they move closer to the middle. When secondary spermatocytes complete meiosis 2, remember meiosis is meiosis 1 and meiosis 2, when they complete that, they are now a spermatid. And spermatids have a circular appearance. That's the blank there. So I don't know if you can see this word here. This says spermatid, and it's pointing to these circular structures that are in the lumen, but they don't have a tail yet. That's a spermatid. The final stage is called spermiogenesis, and when the spermatid, that circular structure, now becomes a sperm with a tail. What happens is the excess cytoplasm is shed and nucleus elongates. It gets a cap, like a baseball cap, called an acrosome. It forms over the nucleus. This is a very important feature, this cap, acrosome. It contains digestive enzymes, and those enzymes are crucial to be able to penetrate the egg for fertilization. As you can see here, the middle has mitochondria, so this produces the energy for the sperm. And the tail is a long flagella, so its function is to move the sperm. So what's the difference between males and females? This is a very rudimentary picture of oocyte, spermatocyte, and the development of, over here, the egg, and over here, the sperm. So this is meiosis 1, this first step, and then meiosis 2. So the big difference, there are 4 sperm produced in males. 1, 2, 3, 4. In meiosis, we have 1 egg cell produced, only 1. And these are the 3 sacrificial polar bodies. And then males and females, they both start this process further at puberty, although females are born with all their primordial cells and they can't make any more. And females are only able to reproduce up until menopause. That's where the period stops for over a year, or the menses, the building up of the endometrial lining. And then guys can reproduce throughout their adult life. And this is just a picture showing what I've already talked about. This is the outside of the seminiferous tubule, so undeveloped, and through spermatogenesis, sperm are produced that go into the lumen through meiosis. So some things that can happen with males as they age. Males over 45 years of age are 4 times more likely to pass on a genetic mutation compared to men in their 20s. So this is interesting. I've always, personally, when I think about genetic mutations and an age-related factor with giving it to your children, I typically only hear of women. But males also, the older you are, you have more of a chance to pass on a genetic mutation. Things like bipolar disorder, schizophrenia, autism, depression, ADD, and ADHD. Those are specific to the men. But age of both sexes carries risk of developmental problems like Down syndrome. So you should be able to answer what's the effect of heat to the dartos and the cremaster muscles, and what sperm structure contains digestive enzymes that help penetrate the secondary oocyte during fertilization.